Now, the Free State government is forging ties with civil organizations and communities in a campaign dubbed Taking Primary Health Care to the People. The purpose of the campaign is to encourage healthy habits in a bid to prevent diseases. Ordinary citizens will be able to freely access a wide range of health care services such as HIV counseling, checking of blood pressure, eye testing, diabetes testing, cancer screening, amongst others. For more, we cross live to our colleague Makhala Masiteng. Makhala, a very good morning to you. What's happening where you are?
Good morning, Desiree. It's true, we are coming through from Koffiefontein in Letseme municipality. This is where the Department of Health in the Free State has taken its campaign to this community to ensure that this community is able to access healthcare services. But close to me, I have the MEC of Health, Montseng Tsiu. She'll be able to give us in details as to what is happening here, as we also know that the access to health has always been a problem, especially in small towns in the province. But she's here to tell us more. MEC, thank you very much for joining us. Tell us what exactly is happening here, especially for people from small towns.
Today we are, as the Free State, commemorating the International AIDS Day. As you know that the world commemorates AIDS Day on the 1st of December of every year since 1988. So as the Free State, we could not hold it on the 1st of December. We decided to hold it today on the 7th of December. But again, what we agreed nationally is that last year the president launched the campaign of Checking Pilo, where people are encouraged to visit the health facilities to check their health status. That they will be checking illnesses such as diabetes and hypertension. Those are non-communicable diseases. But we also check the TB and hypertension, which you know they are communicable diseases as well. We also check the cancer and other illnesses, the eyes of the people, the teeth and everything. In fact, we bring the basic primary health care services to the people in Letseme. But what we have done, this campaign of Checking Pilo started last year as it was launched in the Health Summit that was held in Boksburg by the President. We are, however, not just doing those services, the AIDS Day commemoration. We want to do it, bringing the services to the people so that people can see that the health services that they cannot access, those that are working and those that come from small towns where there are no clinics, where we only go once a month with a mobile clinic. Today we've brought every service to them at their doorstep. The circumcisions that we're doing today, the pap smears, we are then also checking TB, checking HIV, hypertension, diabetes. Yeah.
Yes, MEC, with all the services that we have brought here today in Koffiefontein, what will happen? Because tomorrow you won't be here. There's only a clinic here. They don't have hospital. What is the plan, way forward, to make sure that they do have access all the time?
In fact, that's what we are encouraging. We're just encouraging those that are unable, even those that are able to visit the clinics during the week. We do have clinics in this municipality of Letseme. We have 5 clinics. We have a clinic in Koffiefontein, in Petersburg, in Jacobsdal, Lukhof and Oppermans. But the population of Letseme, all in all, is 34,881. So these 5 clinics are servicing the people of Letseme. We also, over and above that, have 2 mobile clinics that visit the farms, because this is a rural area. We do have farms, so we are providing the availability of health services by also visiting the farms with our own services. That's how we make sure that people access health services. Over and above that, we do have ambulances where people need hospitalization. They are transferred to the hospitals around Harib. We have a hospital, a smaller hospital, a district hospital in Jacobsfontein, and then the bigger hospital that we have, it's in Tromsbeek. Yeah, that is where then our people are transferred to, should they need services that cannot be accessed in the clinics.
But is there a plan to make one of these clinics 24 hours clinics?
Yes, it is. There's a plan to make one of the clinics in Montseng a 24-hour clinic. We have a very good clinic in Jacobsdal that we think we are going to turn it into a 24-hour clinic. We just need to employ more staff. The clinic is big enough. It has got enough facilities, and even it's doing well on the ideal clinic status because it is getting it has got platinum. The latest results were it's doing very well. So we are going to make sure that we just increase staff so that they are able to cover the 24 hours.
But what is the timeline for that to happen?
That would happen after the new financial year, because right in this financial year we do not have enough funds to employ more staff.
Thank you very much, MEC Montseng Tsiu. That is the MEC of Health in the Free State, Montseng Tsiu. She was just telling us about the plans that they have to ensure that the community here have access of health and to make sure that they make some of the clinics 24 hours operational. This is what will be happening here. Community is invited here to come and get these services today as they are brought closer to them, and she has also indicated that they will be taking this campaign even to other areas as they have also been doing throughout the year, and we will be checking as time goes by as to how will the plan of making some of these clinics 24-hour operationals will go. But it's back to you, to the studio, Desiree.